Good morning and welcome. This is Nesta with you on the Morning Brew, and I do hope you're having a wonderful day. As promised, with me in the studio, I do have Dr. Prithvi Mohandas, the Managing Director at MIOT International, India. Good morning, Doctor.
Good morning. Thanks for having me.
How are you feeling today?
I'm feeling very well, as you said, in paradise.
Okay, Doctor. So for the benefit of our listeners, would you mind doing a short introduction and also talk a little bit about your career?
Sure. Some people may have heard of MIOT hospitals. We're celebrating 25 years since we opened the hospital. The hospital was started by Professor Mohandas, who, like me, is an orthopedic surgeon, and he opened it in 1999 when he was 65 years of age. It's a small 40-bedded hospital, only focusing on one specialty, orthopedics. And if you look at my career, and of course twinned with the growth of MIOT, over the last couple of decades, we have slowly developed into a 1,000-bed hospital with 63 different specialties, and we do have a few locations outside India as well.
Fantastic. And as you've mentioned, 25 years.
Yeah.
That's quite a while. 25 years of integrity in healthcare this year. So let us talk a little bit about the journey and how do you see this decade's worth of healthcare services offered by MIOT?
Well, I think one of the focuses on MIOT is to separate science from business so that decision-making is purely for the benefit of the patient rather than any commercial element. And that is why we say we are celebrating the virtue of integrity in 25 years of MIOT coming into existence.
In 130 countries across the globe.
Well, yes, as a lot of people may be aware, in the past, India was not considered a destination for medical care. In fact, a lot of Indians who are well connected or rich left India to seek healthcare. But I think from the 1990s, since the Indian government opened up the economy, healthcare in India has improved by leaps and bounds. A lot of the bulk of research journals published, etc., have Indian authors, and of course that has led to a lot of confidence in the healthcare delivery system in India. And as a result of which, in the beginning, our focus was just treating Indians who had complex conditions, and to reduce the number of them going overseas, we now have a lot of overseas patients, as you mentioned, from around 130 countries coming to us for treatment.
Fantastic. And MIOT has been serving the people of Seychelles for many years now. How do you reflect on this relationship or partnership, as we may call it, and what impact do you think MIOT's healthcare services have had on the local community in Seychelles?
I think the main catalyst and partner in our relationship with Seychelles is the Ministry of Health in the government of Seychelles, who have been very supportive, who have been very proactive, and through whom we are able to deliver as good a service as possible to the people of Seychelles. Obviously, the Ministry of Health directs, advises, and monitors our offering, and our future relationship with the citizens of Seychelles can only grow as trust between these two partners continues to progress.
Fantastic. And also MIOT is known for its infrastructure, investing in state-of-the-art equipment from biplane cath lab to robotics in surgery. A few words in regards to that.
The power in India is the power of volume. My city that I live in, which used to be called Madras and is now called Chennai, has a population of 9 million.
Wow.
And that's compared to Seychelles, which...
100,000.
Yes. So as a result of that, it is possible for us, therefore, because of this large volume, to invest year on year in cutting-edge decision-defining, treatment-defining technology and talent, and also by treating large volumes on a daily basis to increase the expertise of the professionals who deliver the treatment. For example, every day we see just walking into our outpatient department almost 800 patients a day. And we perform every single day 250 procedures. So this volume translates to great clinical and scientific data, knowledge, and expertise.
So now we're gonna go a little bit more in detail in regards to MIOT. MIOT is raising global awareness about genicular artery embolization, a groundbreaking procedure that has now become the topic of the hour. Could you please explain this procedure?
Worldwide, when you look at the disease arthritis, the most common arthritis is arthritis of the knee. It results in a lot of work days being lost, and it results in a huge amount of expenditure that goes into treating this disease. In the very young and in the elderly, overweight, or physically, medically unfit patient, it is a huge challenge to treat this disease. One of the spectrum, the early end of the disease, that end of the spectrum involves young, very, very active patients in their 30s or early 40s who don't want an artificial product to replace their God-given knee joint. The other end of the spectrum, of course, is the patient who's scared that having a complex major surgery might produce risk to their life, or might have a very, very prolonged recovery, or result in certain complications like infection, embolism, or even failure of the treatment. So the crux of the matter, though, both in India and in Seychelles, is the huge amount that the individuals, insurers, and the country spends on treating arthritis of the knee because of the cost involved in these artificial joints. Genicular artery embolization involves no anesthesia, involves no surgery, involves no stay overnight in hospital, and most importantly is 1/5 the cost of total knee replacement. So that's a huge saving for an insurer, an individual, or a government, especially on a yearly basis.
Okay, so you strongly believe that genicular artery embolization is an effective alternative to total knee replacement?
Absolutely, because you end up getting the same result as a successful knee replacement without needing to undergo an open surgical procedure and spending 5 times less. Why wouldn't it be the way forward?
Exactly. And I love the campaign that MIOT has right now, touching the community and putting it in a way that people can actually relate to. There's a lot of things that it stops you, people with knee problems, it stops them from doing other things that they used to love, like trekking, playing football, engaging with the community, with their family. So I think it is an amazing campaign that MIOT is doing right now. So for people listening, who are the ideal candidates for this procedure?
Anybody really with knee pain who does not want to have surgery, and of course anybody with severe knee pain who's been told they should have surgery, for whom affordability is a big factor. These really are the people who should try to access genicular artery embolization.
So how long does it take for patients to recover after the procedure and experience pain relief?
Recover from the procedure itself is virtually immediate. The procedure is basically done via a needle in the thigh. That's all.
In the thigh, huh?
Yes. And usually, say the procedure is done at 8 a.m., then we do the procedure. It takes 90 minutes, and then we keep you for a little while to observe you, and then say 2 p.m. you're back home.
Wow.
When you say physical recovery, it depends on how long your knee has been affected. If it's been affected for over a year and you've got a little bit of muscle wasting, then after the procedure, yes, your knee pain is gone, the movement, flexibility of the knee is back, but you'll have to work to strengthen your muscle. And so once your muscle is strengthened, you can go back to your sport, your activities that you enjoy, without pain and with full mobility.
Amazing, amazing. Could you share maybe a few success stories of patients who regain mobility after undergoing GAE at MIOT?
There are so many stories at various ends of the spectrum.
Yes.
I don't know whether people are aware that this procedure not only can be done for patients who feel that they don't want to take a risk having surgery, it can also be done for patients who already had the same knee replaced and they're not happy with their replacement.
Oh, wow. That's amazing, huh?
Yes, we had a patient from Mauritius who had a knee replacement done, and the doctor kept saying, your x-ray is fine, your x-ray is fine. And the patient came to us, severe pain, swelling, it was not infected. The implants looked fine on the x-ray. And after GAE, she's around 72. Her pain was gone, and she was so happy. She could go back. She could go back to her social activities. She was a big social butterfly. She could go back to meeting all her friends. So yeah, that was a fabulous story.
Yeah. So it's like giving her life back,
Absolutely,
Yeah.
absolutely.
Of course. So with MIOT's expansion into Seychelles, how do you envision this procedure helping the Seychelles? I've had a lot of people complaining about knee pains. So yeah, if we can talk a little bit about it.
Yes, we are intending to hopefully, open our own purpose-built 4-story MIOT building by the end of the year, and hopefully soon after that we could offer this to people at their doorstep, literally, without having them travel overseas.
Okay. So maybe for the next question, we can elaborate a little bit about MIOT's future plans for expansion in Seychelles and beyond. Yeah?
Yes, I think really our focus to expand has been in countries where there's 1, 2, or 3 very, very crucial areas that they want immediate support, and also in countries where there will be uptake, where there's volume of disease and population, and a very, very easy supply chain. So these are the areas that we actually look at when we consider expansion. Therefore, of course, one of the crucial issues in Seychelles is the fact that although there is big disease load and there's huge awareness about disease, the capacity to understand and the comprehension levels here are very high. One of the problems is being able to afford to pay for brand new technology or for high-skilled individuals to perform procedures. If it's very costly, a lot of people will not be able to afford. So our goal is to focus on, yes, new technology, but also really to try to provide it at the most affordable cost. And this is where a lot of understanding and education and communication is key, because when you are investing in very expensive, very modern technology that has amazing results, when you need very skilled, highly qualified professionals to administer the care so that there is no complication, it finishes very quickly and recovery is virtually as instant as possible, these people don't come cheap. They need to be paid because of the amount of experience they have, and the technology doesn't come cheap. So there is a balance that needs to be made so that the technology and the talent are offered at a cost that is comfortable for the population to pay.
And also value for money, yeah?
Absolutely,
of course.
Absolutely.
As MIOT looks to the future, what message would you like to share with Seychelles people?
I think there's a huge element of hope in the future of healthcare, because we are able to treat more complex diseases. Our treatments have become simple, and the treatments have become less invasive. So previously, if you had been told, oh, you're not fit for the treatment, or previously if you had been told, oh, this treatment costs this much, we're now looking at costs, as we have for genital artery embolization, being 1/5 of what they were, and of course treatments being very, very non-invasive and therefore safe, even if you have other diseases, or if, as some people feel, oh, I'm overweight, maybe there's a risk of anesthesia. So all this is something that you can look forward to.
There you go. So MIOT celebrating 25 years of integrity in healthcare this year, and we've managed to have a talk with Dr. Prithvi Mohandas, Managing Director of MIOT International India. A very interesting conversation, and of course we welcome MIOT to Seychelles once again, and we're going to say thank you to you, Dr. Mohandas, and all the best, of course.
Merci beaucoup.